नमस्कार दोस्तों, वंस अगेन वेलकम टू फर्टिलिटी दोस्त प्लेटफॉर्म। आज किसके बारे में बात करें? एम्ब्रियो ट्रांसफर के बारे में बात करें या फर्स्ट हाफ ऑफ द जर्नी, जिसको कि वी इन सिंपलर लैंग्वेज जस्ट यूज टू कॉल OPU या एग रिट्रीवल. So when we usually start our IVF journey, we just categorize the whole process into two parts. First is egg retrieval and second is embryo transfer. आई थिंक एग रिट्रीवल में हम लोगों को इतना टेंशन नहीं रहता जितना हमारे दिमाग में प्रेशर बन जाता है व्हेन वी गो फॉर एम्ब्रियो ट्रांसफर. सो हमने सोचा कि आपने बहुत बार हमसे सवाल पूछे कि नाउ व्हाट टू डू ड्यूरिंग दीज 15 days, और बड़ा टेंशन है, बहुत प्रेशर है, मैं सीढ़ियाँ चढ़ लूँ, सीढ़ियाँ उतर जाऊँ, बेड पे किस पोजीशन पे बैठूँ या सारा दिन रेस्टिंग मोड में रहूँ, व्हाट अबाउट माय ऑफिस वर्क, व्हाट अबाउट माय किचन वर्क. सो हमने सोचा लेट्स कॉल अ वेरी नोन डॉक्टर फ्रॉम दिल्ली to just answer all your queries related to this embryo transfer. So today's topic is, I would say that very important topic is tips for successful embryo transfer. So ladies, viewers, आप जो भी अभी अपने आईवीएफ ट्रीटमेंट के प्रोसेस में हैं या आप शुरू कर रहे हैं या यू आर जस्ट इन द मिडल ऑफ योर प्रोसेस, प्लीज डू वॉच दिस सेशन. और ये सेशन अगर मान लीजिए आप बीच में ज्वाइन नहीं कर पा रहे हैं तो दिस सेशन विल बी सेव्ड ऑन दिस लिंक, सो प्लीज प्लीज जरूर देखिएगा. एंड टू स्टार्ट विद द सेशन वी हैव वेरी नोन फेस, वेरी नोन आईवीएफ स्पेशलिस्ट with our own Delhi. We have Dr. Bhavna Mittal from Delhi, and let's call her on the main screen and just start with the session. And sorry viewers for starting in late, thoda sa network issues the. And once again, thank you UNS for arranging this informative and really very interesting topic session. Namaskar Dr. Bhavna, welcome to Fertility Dost.
Hello Purnima ji. Thank you for choosing such an interesting topic. I think it is a very close to the heart topic to me also, and I think we can provide lot of useful information to the viewers. And thank you UNS for organizing this meeting too.
So viewers, we have Dr. Bhavna Mittal with us. She's IVF specialist from Shivam IVF Delhi. Delhi people must have visited her once, और नहीं तो आप जरूर अपने fertility specialist के तौर पे इनको visit कर सकते हैं. She has treated many infertile couples, and we can say including male and female infertility, both cases she has handled very well. She has her, I think, the expertise or her the topic or the process close to her heart is just embryo transfer. So we decided to choose this. So Dr. Bhavna, let's start with the session. And सबसे पहले एक बड़ा common सवाल, 15 दिन रेस्ट करूं कि उठ के काम करूं?
See, when we do IVF, एक तरह से आप कह सकते हैं हम अपने पूरे प्रोसेस की मेहनत, चाहे वो पेशेंट की मेहनत हो, उसके हस्बैंड का इनपुट हो या वाइफ का इनपुट हो, सब कुछ एक एम्ब्रियो के फॉर्म में इम्प्लांट कर देते हैं यूट्रस के अंदर. उसके बाद में उस एम्ब्रियो का क्या होता है 15 दिन, वो डिपेंड करता है उस 15 डेज में वो लेडी क्या केयर लेती है. नाउ इस टॉपिक के ऊपर बहुत सारे मिथ्स भी हैं, बहुत सारी मिस इन्फॉर्मेशन है. सो वी हैव टू मूव साइंटिफिकली कि एविडेंस क्या कहता है, डाटा क्या कहता है, प्लस उस डाटा को हमें अपने इंडियन सिनेरियो में मॉडिफाई करना है.
Right.
So like we all know that IVF is a technique which is followed worldwide. There's lot of international information, data, बड़ी बड़ी स्टडीज हैं जो बताती हैं कि IVF में कितना रेस्ट करना ज़रूरी है या नहीं ज़रूरी है. So basically they say you can do normal light routine activity, जैसे कि सेल्फ केयर, जो आदमी अपनी खुद की केयर के लिए काम करता है उतना काम आप कंफर्टेबली कर सकते हैं, लाइक गेटिंग अप, गोइंग टू द वॉशरूम, मूविंग फ्रॉम वन रूम टू द अदर, or doing some light, very light household work like some light chopping, some folding the garments, ऐसा कुछ हल्का वर्क आप कर सकते हैं. If you are a working lady and your work involves some work on the laptop or some sitting job which you can do comfortably, which does not involve too much traveling, exertion, bending, lifting heavy things, you can also do your routine occupation. In fact, we usually prefer to let the ladies do their routine work because when they are doing their routine work, they are less engaged mentally into the process. वो लोग मेंटली ज़्यादा रिलैक्स रहते हैं, अपना रूटीन का काम करते हैं तो उनका माइंड डाइवर्टेड रहता है, स्ट्रेस नहीं होता. तो इट इज़ ऑलवेज बेटर टू फॉलो योर रूटीन. But at the same time, you have to take care that you do not do any such thing which puts strain on your tummy, like if you're sitting for prolonged hours, or if you're bending, you are lifting something heavy inadvertently, dhyan nahi diya, aap ulte let rahe. So these kind of things you can avoid. Otherwise, your normal light routine activity you can comfortably follow. Sometimes we as doctor also give over the board suggestions कि भाई आप इतना नहीं करिए, because हमें ये भी देखना पड़ता है कि बहुत सारी ladies families से आती हैं. Sometimes you are in joint families, so if we do not give the suggestion of bed rest, then the lady will be doing other kind of housework and everything. So that's why we say take rest, and the best thing is let your body decide. जो आपकी बॉडी आपको अलाउ कर रही है, जिसमें आप कंफर्टेबल रह रहे हैं, आपको दिक्कत नहीं हो रहा, आपका बॉडी ठीक से रिस्पॉन्ड कर रहा है, जस्ट उतना ही करिए. डोंट स्ट्रेच योर सेल्फ टू डू एनीथिंग एक्स्ट्रा. इट्स अ वेरी स्पेशल पीरियड. द मोस्ट important thing at this time is to take care of yourself. Other small works any other person in the family can also take care, but अपना ध्यान रखना वो सिर्फ आप ही कर सकते हैं इस टाइम पे.
Right. And we can say that please take care of yourself with all love and handle yourself carefully. Uh,
Definitely.
so, doctor, whenever we go for embryo transfer, so it's like usually if we talk about the embryos, so there's something related to day 5 and day 3 embryos. So कहीं ना कहीं दिमाग में लोगों के चलता है, मे बी इट्स अ काइंड ऑफ मिथ, that day 3 embryo ka success is really less, so automatically we have that stress in our mind when we go for day 3 transfer. So what you suggest for our viewers related to this day 3 transfer of embryo?
सी आपने बहुत अच्छा मुझसे ये क्वेश्चन पूछा, बिकॉज आई एम फॉर्चुनेट कि मैंने इस पे एक पूरी थीसिस करी है, डे 3 वर्सेस डे 5 एम्ब्रियो ट्रांसफर. एंड अगेन सेम थिंग आई विल से कि देयर इज आल्सो इंटरनेशनल डेटा सपोर्टिंग इट. पहले रूटीनली जब से आईवीएफ स्टार्ट हुआ था, एम्ब्रियो ट्रांसफर क्लीवेज स्टेज पे ही होता था, सेकंड डे थर्ड डे पे ही होता था. यू कैन से ओवर लास्ट 10-15 years द टेक्निक ऑफ ब्लास्टोसिस्ट ट्रांसफर, दैट इज डे 5 ट्रांसफर, हैज caught up. Definitely the result of day 5 transfer is better, but nothing can be generalized for everyone. Everything depends on a case to case basis. So there
Right.
can be an individual case in which a day 2 day 3 transfer is better. There can be a case in which a day 5 transfer is better. For example, if you just have few embryos on day 3, you do not have enough embryos to culture further, देन इफ यू
Hmm.
गेट योर, बिकॉज कुछ पेशेंट के माइंड्स में ये सेट होता है कि हमें डे 5 ट्रांसफर ही कराना है, बिकॉज ईदर समबडी हैज टोल्ड देम और दे हैव रेड कि डे 5 इज बेटर. सो इन दैट केस इफ यू डू नॉट हैव सफिशिएंट एम्ब्रियोज टू कल्चर टिल डे 5, और आप इंसिस्ट करते हैं कि नहीं हम डे 5 एम्ब्रियो ट्रांसफर ही कराएंगे, तो समटाइम्स यू लूज द चांस ऑफ एनी एम्ब्रियो ग्रोइंग फर्दर. ये भी हो सकता है कि आपका रिजल्ट उस दिन अच्छा नहीं हो, एम्ब्रियोज आगे नहीं अच्छे से कल्चर हो. And
Right.
sometimes there has to be a coordination between the endometrium and the embryos. So if that coordination your doctor feels is better for day 3, then go for day 3 transfer. If the doctor feels it is for day 5, then go for day 5 embryo transfer. I think there should always be individualization. Should be case to case basis. But yes, the center where you are going, वहां पर day 5 embryo transfer available होना चाहिए. So if it is better for you, the doctor will do it for you. सो चूज अ सेंटर जहाँ पे ब्लास्टोसिस्ट ट्रांसफर होता है रूटीनली, बट उसके बाद में वो आपके लिए होगा या नहीं होगा, वो आपके खुद के केस पे डिपेंड करेगा.
Right, right. So I think it's not necessary to compare your protocol of treatment with another person. And usually, Dr. Bhavna, we have seen cases जहाँ पर लोगों को लगता है कि डॉक्टर ने मुझे डे 3 बोल दिया है, so कुछ तो गड़बड़ है. And one more query we have related to this uh, blood test after day 15 days. So someone is saying कि I have blastocyst transfer. So can I go for the pregnancy test after 9 days of transfer? Is it really so?
See, you can do a test after 9 days, because normally embryos implant one like blastocyst will implant within 1 or 2 days. So अगर आपने 5th day का ट्रांसफर कराया है, तो 1-2 दिन के अंदर एम्ब्रियो स्टिक हो जाएगा अगर उसको होना होगा. So if you are doing a blood test after 9 days of your transfer, then you can get a small positive value. But if you are doing that test, you should go with a very open mind that if the test comes negative, then do not draw any conclusions out of it. अगर पॉजिटिव आता है तो आपने
I think we lost the connection in between as Dr. Bhavna is traveling. She has some emergency case at her center. Doctor, can you hear me?
या आई कैन हियर यू.
Oh,
सो इफ
yeah, please.
सो अगर आप 9th डे पे टेस्ट कराते हैं, आपका बिल्कुल टेस्ट कराना वैलिड है, आप करा सकते हैं. अगर वो पॉजिटिव आए तो टेक इट एज पॉजिटिव, बट अगर वो नेगेटिव आए सो डू नॉट गेट disheartened and do repeat your test, because it just depends that when the embryos have implanted, and your test could have been an early test in that case.
Right, right. Understood. And what about Dr. Bhavna when we go for home kit pregnancy test? So usually people says कि बड़ा faint line आया था, अब टेस्ट कराने जाऊं ना जाऊं. So क्या सच में हमें these kits are reliable, or we just need to go straight with blood test only?
See, actually, the thing is, we usually prefer blood test, but
Hmm.
sometimes because of availability issues, if patient is in a remote area, sometimes we tell them to do urine test also. Now, the difference between a blood test and a urine test is that blood test has sensitivity for beta HCG hormone above 2. So, if the value is above 2, it will show in your blood test report. But
Right,
urine test has a sensitivity of 25 to 50, depending on the kit. So if your blood test is above 25 or 50, then only the kit will show. Second thing is that when you're doing a urine test, sometimes your urine will be concentrated. Sometimes it will be dilute, depending on how much water you have drank and when you passed urine. So
right,
that can also change the level of beta HCG in your urine. So ideally, if you're doing a urine test, it should be done with first morning sample of urine also. Thirdly, the urine pregnancy test kits should ideally be stored in the refrigerator. So sometimes when we pick them up from the chemist, they are not in the refrigerator, or if they're of a poor company or something, then the kit may be faulty, and unnecessarily you will be stressed after doing a test that it was negative. That's why it's
right.
preferable after such an important procedure of IVF not to rely on a urine pregnancy test which can be sometimes doubtful, and go for a proper blood test only, because you cannot call off yes or no to such a big treatment with a test which has a doubtful efficacy.
Right, right, right. So next time, please do consider these pointers that, as Dr. Bhavna mentioned, blood test is always reliable test. So, doctor, we'll be taking one query over here. I'll just highlight on the screen and read it out for you. I have diffuse adenomyosis, had recurrent miscarriages. This time, doctor suggested etoseban injection before FET. Kindly tell me the role of this injection.
See, atosiban is an injection which is, you can say, it acts as a uterine relaxant. So, like you have mentioned, you have diffuse adenomyosis. So, what is adenomyosis? In common language, you can say adenomyosis is like swelling of the uterus. So, the uterine walls are thicker, there is more blood flow, the contractility of the uterus is altered. Okay, and also you are giving history that you have recurrent miscarriages. So, definitely any drug which can help the uterus to relax can increase your chances of success of IVF, and also it can reduce the chances of miscarriages later. So it is a viable option. If your doctor has suggested, you can go by that option. It is not that this is the only option or this is the first line treatment. We do many other things to relax the uterus, like you are on progesterone injections and everything. So but this can be used as an add-on thing, and definitely if your doctor is advising you, it is because you are as such, yours might be a difficult case. So to try something which is better for you, they have suggested to use atosiban injections. So you can go ahead with that. It can help you in uterine relaxation and improve your success with IVF and pregnancy outcome.
Right. So, do trust your doctor. What your doctor has been suggesting to you, she's taking care of each and every medical parameters for you. So, doctor, you just mentioned about the physical activities or things we have to do. Now, the next important question here is, what about the diet? So there are mixed reactions over this. Someone says कि you don't have to eat papaya, pineapple, and वो जो गरम चीजें होती हैं. Is it really so?
See, anytime I feel food is very important. Food is what makes our body. Even if we go by our Indian system of medicine, Ayurveda, lot of importance is given to food. So
Right.
definitely food is a very important aspect of post embryo transfer care. Also, because the lady has been undergoing so many hormonal treatment throughout the month, she's on medications, she may have some underlying conditions like diabetes, hypertension, etc. That is why counseling about food is very important. It's best that you get your, your center, some dietitian to counsel you, get your proper diet chart made, clear your myths about food, as per your case, like case to case basis. So you should
Right.
clear your doubts about food and take proper guidelines. Now, some common pointers are that because you will be mostly on rest, your food should be light. It should be easily digestible. So it should not be something heavy which makes you difficult to lie down and take rest, and it becomes heavy for you. So you should not be taking that kind of food. Take small meals, but take frequent meals. So try to eat something small every 2 hourly. Rather than taking a big heavy meal, eat frequently, eat small frequent meals. Your diet should be good in fluids. So your fluid intake should be very high. That is especially important because after you have done your vaginal procedures like pickup and transfer, you're prone to infections also. So if your fluid intake is good, so that automatically helps in clearing some small infections. So your water intake should be very good. Fiber intake should also be very good because you should be taking lots of salads, fruits and all, because you'll be on medication. So many women complain of constipation. So it is important to take good fiber intake. As such, in our allopathy, there is nothing garam, thanda and all. But
Hmm.
if there is something which is followed at your home, I will still say don't contradict anyone. If you are asked to leave a particular food item, तो उस चीज का स्ट्रेस करने की जगह उसको छोड़ के हम बाकी चीजें भी ट्राई कर सकते हैं. So and obviously you have to avoid heavy food, spicy food, junk food, outside food. You should minimize the use of toxins in any form, whether it is caffeine, tannins like tea, coffee, and all. And of course, no alcohol and smoking, that goes without saying. So that should not be there. Try to take natural foods, home food, natural food, home cooked food, rather than any packaged food or juices or soups. So if you are asked to take fruits and salads and soups, try to take natural food rather than anything canned or out of the packet. So I think these should be the general things. And then depending if you have any coexisting problem, accordingly you should take specific instructions from your doctor that what or what I should not eat. Eat what your body is used to. So if there's a South Indian person who's used to eating idli, sambar, dosa, he should eat that food. Na? So there's no point I tell him you eat chapati. So what you
Chapati.
eat mainly, what your body feels light and you can digest and handle easily, whatever is your routine habit, eat that food. So that is the principal key.
Right. So eat healthy, stay healthy is really the principle. And if you really want to take consultation from nutritionist, then do let us know. We have in-house nutritionist who will help you in this process. So doctor, here we'll take another query. Doctor, as you said, the embryo, it has to implant. It will do that in first 2 days. Are there any changes that happen or sign that we come to know that the embryo has stuck?
uh, See, unfortunately, there is nothing that you can make out. So there is no symptom, sign that you or your doctor can pick up so early. The earliest which can be done is a blood test only, which confirms whether you have conceived or not. So many time people, they come up with different myths that I'm having a cramp-like feeling, just like a period. But you can get similar cramps even if you are getting a pregnancy. So this, there's nothing that you can make out. And don't get disheartened if you are having any such symptoms also. Sometimes people will say कि मुझे cramp start हो गए हैं, मुझे तो लग रहा है मेरे को period आ गया है, and then they put
Right.
it in their mind and it bears on them psychologically. You might get the similar feeling even if it's a early pregnancy. You get the same crampy, stretchy feeling. So just relax. Try to relax as much as possible. Leave it to God for some time. So there's as such nothing that you can pick up yourself, or even for that matter, no doctor can also pick up till you do a blood test beta hCG, because that's the earliest sign of pregnancy.
And doctor, one very important talks which revolve around this implantation thing is implantation bleeding. क्या सच में ऐसा कुछ
Yes.
है क्या? We lost your voice, Dr.
See,
Bhavna.
hello, hello,
Hello. Yeah, yeah,
hello.
please. And
See, implantation bleeding definitely is a known phenomena. So it is very much documented in the books. Hello.
Doctor, I think there's network issue again. Can you hear me?
I think I will just I'll rejoin in a minute. I think there's some disturbance. I'll just rejoin in a minute. I'll rejoin again.
Okay, okay, fine. Okay, okay, fine, fine. So viewers, just stay here in the session, and we have, you can say that marathon of sessions, one after the another. At 4 p.m. also we have one session, and at 5 p.m. also we have one session. So stay connected with us, and I think within a minute or so, Dr. Bhavna will join us again. So keep pouring your queries related to embryo transfer. And as I just mentioned few minutes back, that if you are going for embryo transfer and you really want us to take care of your diet, your nutrition, please do let us know. Just send us a message on our official number. और नहीं तो यहाँ कमेंट बॉक्स में भी लिख सकते हैं आप कि यू वांट टू नो अबाउट समथिंग इम्पोर्टेंट अबाउट योर डाइट स्पेशली डाइट आफ्टर एम्ब्रियो ट्रांसफर हम आपको कनेक्ट करेंगे एंड वील डेफिनेटली प्लान योर पर्सनलाइज्ड डाइट फॉर दोज beautiful 15 days. So let's wait for the doctor in a minute or so. She'll be joining. So if you yes, so we were discussing about the implantation bleeding. I don't know ये कितना सच है कितना गलत है but usually we have this query whenever anyone is undergoing embryo transfer. So let's see, let's wait for another minute. uh, Viewers, do check our free e-books. आप उसको डाउनलोड कर सकते हैं. We have free e-books related to diet. We have free e-books related to your yoga and yoga and everything, asanas and nutrition plan. Everything is mentioned over there. So you just can download those free ebooks. And here I can see the doctor again. Okay, let me just add her. Yeah. Hello, doctor. Can
Yeah,
you hear
hello.
me? Yeah.
Yeah, I can hear you.
Okay. So we were discussing about that implantation bleeding.
Yes. So implantation bleeding. So I'll start from the basic. When we are taught about embryo implantation, जब हम पढ़ते हैं, जब हमें बुक्स में पढ़ाते हैं, तो उसका प्रोसेस क्या होता है? एम्ब्रियो जो होता है इम्प्लांट करता है, वो एक तरह से एक इंजरी क्रिएट करता है एंडोमेट्रियम में, एक रॉ एरिया क्रिएट करता है. उसके
Hmm.
बाद वो धीरे धीरे एंडोमेट्रियम के अंदर बरी करता है, और जो सराउंडिंग ब्लड वेसल्स हैं उनको ओपन करके अपनी ब्लड सप्लाई इस्टेब्लिश करता है. तो अगर हम ये प्रोसेस को इमेजिन करें अपने माइंड में, तो वी कैन ऑल्सो इमेजिन दैट इट इज पॉसिबल ड्यूरिंग दिस प्रोसेस some bleeding or spotting can happen. It's possible, so that when the embryo is burying down, creating its space, connecting, making its blood supply connect, it is possible that some bleeding happens at that time. In fact, ये documented है, ये books में, literature में लिखा हुआ है कि implantation bleeding होती है. Even हमारी old aunties बताती हैं कि कुछ लोग होते हैं जिनको पीरियड आते रहते हैं पर प्रेगनेंसी रुक जाती है. तो आई
Right,
थिंक दिस
right.
इज दैट इन द कॉमन लैंग्वेज. So we also in our practice, especially in IVF, many a times see implantation bleeding. Now the problem which happens is that as soon as the patient sees bleeding, she gets very worried कि अरे मेरे को bleeding हो गया है और period आ गया है. But sometimes later we check and pregnancy test comes positive. So if you have any such thing that you have implantation bleeding, if you have some bleeding after embryo transfer, don't be in a rush to judge कि क्या हो रहा है. बहुत
Yeah.
जल्दी अपने माइंड में आप ये मत सोचिए कि ये मेरे को पीरियड्स आ गए. ये कुछ भी हो सकता है, ये अर्ली प्रेगनेंसी की ब्लीडिंग भी हो सकती है. इफ यू हैव एनीथिंग सच, just contact your doctor immediately, let them evaluate you, let them give you some medication, rest, and then decide what's happening, because sometimes this bleeding can be indication of pregnancy sticking in your body also.
Right,
So
right.
जब पेशेंट हमें कॉल करता है कि हाँ स्पॉटिंग हुई है, वी गेट हैप्पी एट आर एंड कि शायद इसका इम्प्लांटेशन हो रहा है इसलिए हो रहा है. बट ऑन द अदर हैंड, दूसरी तरफ जो पेशेंट होता है वो बहुत परेशान होता है, क्योंकि उसको लगता है मुझे तो ब्लीडिंग, अगर मेरा तो ट्रीटमेंट पहले ही खराब हो चुका है.
और अगर bleeding ना हो then also there is nothing to worry. So
Yeah, of course, it's not a necessary thing. it, it
right,
was,
right.
mm.
So, doctor, I have one query over here. Uh, Can you please throw some light on endometrium lining zones and blood flow? If I have zone 3 level blood flow at day 13, is it good?
या इट इज फाइन आई थिंक सी कभी भी ना हमें किसी भी चीज को बहुत ज्यादा व्हाट आई फील लाइक मतलब जो मेरा अपना पर्सनल इवैल्यूएशन है हमें किसी को बहुत ज्यादा कैटेगराइज नहीं करना चाहिए ठीक है सो इफ यू आर हैव अगर हम हिस्ट्री से शुरू करें इफ यू आर हैविंग अ नॉर्मल 2 to 5 days period you have good blood flow during your periods and like on your endometrium is between 6 to 12 mm on around day 10 to day 14 of your cycle and it is a trilaminar pattern with good subendometrial blood flows, then do not worry, do not go very deeply into the the zones and the endometrium and everything because सारा डेटा हम लोग इतनी बार देख चुके हैं कि कई बार according to data it is saying poor endometrium but still implantation happens and sometimes in very good endometrium implantation does not happen but if in zone 3 you are having blood flow then that's totally fine. I think there should not be a problem if your thickness of endometrium and other things are good.
So please go ahead with the transfer as your doctor suggested and don't worry. कुछ भी सवाल कुछ भी doubts हैं तो please do ask and if you are in Delhi you do visit Dr. Bhavna and get yourself examined. देखें तो सही कि आपका ट्रीटमेंट कहाँ रुका है क्यों रुका है. So thank you Dr. Bhavna, thank you so much for joining today. We know थोड़ा initial hitch था but
Mm-hmm.
we just sailed through the session and
Yes.
sorry for joining late viewers because we have some network issues. Hope you like the sessions और अगर कुछ भी सवाल आपके रह गए हैं तो please do post in the comment box. We'll get them answered by the doctor. Thank you Dr. Bhavna once again.
Thank you
Thank you.
so much. Beautifully chosen questions. And I'm happy to help anytime, even if you cannot visit me. If you have any questions, if you put me a post, I'll be more than happy to answer. Thank you,
Sure.
Purnima ji. Yeah.
Thank you. Thank you, doctor. We'll post the queries if we have any and we'll directly send you those.
Thank you.
Okay, bye bye.